I'm known for the House of God. It's sold 3 million copies so far, everybody reads it. And the message of the House of God was that isolation is dangerous and good connection is healing. And in the House of God, everybody got isolated from each other, and they got they got isolated from their authentic experience of the system. And so we started to think we were crazy for thinking it was crazy. And that message that I took from that is that it's not healthy if you isolate yourself, and that the way to heal and the way to grow psychologically is in good connection. And one of the other things that I've written is called Bill W. and Dr. Bob, which is about the relationship between the two men that founded Alcoholics Anonymous and their wives, which has been done in New York off-Broadway twice now and is going around the world. The reason I bring that up is because Bill Wilson was a drunk stockbroker, Bob was a drunk doctor, and they happened to meet by chance in Akron, Ohio when both were near death, and by telling their stories to each other, they each survived and started this incredible organization, Alcoholics Anonymous, which is the best treatment for alcohol, the disease of alcoholism. And what they discovered were two things. One is that Bill discovered that the only thing that could keep him sober was telling his story to another drunk, which is all in the narrative tradition of healing. A drunk can't stay away from alcohol alone. He has to ask for help from either another person or something outside himself, not God necessarily. The second thing they discovered, well, the idea is that the connection heals. The other thing they discovered is that alcoholism is a disease with physical, psychological, and spiritual elements, and it had to be treated in all three ways in order to succeed. And that led to the discovery of the holistic tradition in America in 1935. And what I'm doing now, I speak all over the country, all over the world. I'm at NYU Medical School, which is a terrifically compassionate, humane medical school. And I talk about to everyone, I try to teach them, how do you make good connections? Doctor-patient, doctor-colleague, doctor-nurse, all of that. And that has to do with shifting your idea from the primacy of self and look at the primacy of the we, which you create when you're with another person. The centrality of the we, of making good connections, not communicating. Communicate with a computer. You don't communicate with a human being, you connect or you disconnect from a human being. But if you learn to do that, whether you're the CEO of the medical institution or whether you're the person that empties the trash in the emergency ward, you will create an environment that empowers everyone, because everybody feels better, they're allowed to speak up, and it will improve the health of the medical system because there will be fewer burnouts, arguments, real fights. Because why do people stay in jobs? Why do people choose jobs? Because they go toward institutions that give them a sense of connection and that give them a sense of a mission to do something good with their lives in the world. And medicine's perfect for that. But what's happening, in the National Health Service, which is screwing itself now by the government, from what I can understand, and the American healthcare system, by the private insurance industry, is that people are getting isolated from each other because they're under so much financial pressure and so much work pressure that they have trouble connecting. The other thing I have to say, I haven't said yet, here is, it's not just what you do or say to make a connection. It's what you do or say next. Nobody ever gets it right all the time, right? With your husband, your wife, your colleague, you always screw up. The people who make it and who make an environment that helps is they see that they've blown it and they say, hey, wait a second, what do I do next? And that helps.